Bagnell, you're eating so fast. Yeah.
Sorry, I was trying to finish before we went public.
Okay, we are public. I wish to welcome everyone to this meeting of the Health Occupations and Long-Term Care Subcommittee of the Health and Government Operations Committee. We have 5 bills on our agenda, and we will begin with House Bill, I believe we should begin with House Bill 406, State Board of Examiners for Audiologists, Hearing Aid Dispensers, Speech Language Pathologists, and Music Therapists, appointment of members and quorum, Delegate Gazzoni's bill. Council, can you explain the bill for us, please?
Sure. This bill alters the appointment process for members of the State Board of Examiners for audiologists, hearing aid dispensers, speech language pathologists, and music therapists. As introduced, the bill requires the governor to appoint audiologists, hearing aid dispenser, and music therapist members with the advice of the Secretary of Health from a list submitted to the Secretary and the governor by the board instead of by specified professional associations. Additionally, as introduced, the bill requires the board to notify all licensed hearing aid dispensers and music therapists of relevant vacancies for the purpose of soliciting nominations and clarifies that a quorum requires a majority of the appointed members of the board. There is an amendment that has been distributed that strikes the bill except for the provisions related to appointing hearing aid dispenser members.
Okay, and who is the author of that amendment? If I could.
Delegate Cullison, which I'm not sure if she is arrived yet.
Delegate Cullison's amendment, purpose of which is the result of conversations. Are you aware of that?
I know that she had conversations with a few of the other delegates on the subcommittee. I'm not sure who else she talked to.
Okay. So we can, is there a motion?
Are you on mute, Ashley?
Has that amendment been offered?
I would move the amendment.
Amendment is moved. Is
Second.
there a discussion on the amendment? Is there a motion on the amendment?
Move the amendment.
Sorry. And is there a second?
Second.
I see Keena Stevenson wishes to speak to the amendment. Ms. Stevenson? Please go ahead.
Hello, everyone. And in regards to the amendment, we do appreciate the committee's time and giving this bill some consideration, also Delegate Cullison's time and trying to find a middle road here. And I'm seeing that the hearing aid dispenser portion of the bill was stricken, and I'm sure that's as a result of the current quandary that we as a board have found ourselves in as far as having hearing aid vacancies that we are unable to fill due to our current statute. So we are in great appreciation of those efforts. However, you know, by this being a 2-part bill, as far as the appointments process and as far as the quorum component, we really strongly feel that the quorum component is still needed, you know, for the sake of time management and productivity efforts, you know, as well as consistency with all the other health occupation boards. You know, we have several health occupation boards that are multidisciplined that do not have that quorum component in their statute as far as the discipline representation for each open session meetings. We just really want the committee to keep in mind that, you know, it rarely happens, if never hasn't even happened in my time that I've been here, where something has come up that will require a single discipline vote, meaning an issue that would just affect one particular discipline. If that was to happen, of course, that meeting would be postponed until we have full party representation. So again, just to be consistent with our other health occupation boards, we would like that quorum piece to be strongly considered. And also, if you want to go back and tie it into the appointments process, whenever there's an appointment delay, that quorum piece would also be affected. So, you know, again, we just want that quorum piece, you know, up for consideration.
So on the what would the motion before us, the amendment do, council? Oh, Bonnie Cullison, Delegate Cullison, Vice Chair Cullison. If you're not out of breath, You're welcome to speak to your amendment. You look a little out of breath.
Thank you. I was running from the house. Thank you very much, Mr. Chair. And I want to thank Ms. Stevenson for her remarks and for her working with us. I do sympathize with the fact that this is a very challenging board with representing many different health professionals. And so it puts it puts the board in a bit of a challenging situation. There are other boards that cover multiple disciplines, but not as many as you all. And I appreciate the commitment to making sure that those who are most affected by decisions would always be represented on the board. But and that commitment may exist now, but it may not exist forever. And where the way that we can rely on the fact that there won't be decisions made about a particular professional if there isn't representation when the decision is being made. And that's why we'd like to go back to the original quorum requirements, and know that this isn't the end of these discussions, because we're hearing what the board needs us to have more discussions about its operations. And because we weren't able to really clarify and look at how this board is operating versus other boards, and maybe there are ways to create an appointments process which is more streamlined and which is clear for all boards. I think this is something, when Mr. Chair, you appointed 3 of us to talk about these issues the last time we discussed the bill, and we agreed we need to continue these discussions, but in order to be able to move forward on the hearing aid specialist, we needed that part of the bill, because we do want the board to be able to fill that seat. So with that, I'm not sure if the amendment has been made.
Yes, it has.
Okay, then I would be supporting the amendment to strike the rest of the changes in the bill, except for the part that is related to the hearing aid specialists.
Okay. Is there further discussion on the amendment? Okay. Has there been a motion to move the amendment? Yes, there has. Offered by Delegate Bagnall. Any further discussion? Seeing no hands for discussion. All those in favor of the amendment? Delegate Riley, are you speaking to the amendment? Or are you voting? You're muted, so we can't tell.
I will wait until the bill. Thank you.
Okay. Oh, okay. So the amendment is before us. All those in favor, please say aye.
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 Is anyone opposed to the amendment? I don't see everybody at the moment. Is anyone against the amendment, please say nay. Okay, the amendment is adopted. Is there a motion on the bill as amended?
So moved.
So moved
Second.
and seconded. Is there discussion, debate on the bill as amended? Delegate Riley.
Thank you, Mr. Chair. I appreciate it. So
Sure.
I'm assuming that the amendment, after listening to our vice chair, that it kind of takes a similar back to the posture of our bill from last year. Okay, so that's good, because I do believe that, because originally I was a little confused of why we needed this bill, because we just changed it last year. And so that's where the confusion came in. So originally I came into this meeting, voting no on the entire bill, but now it sounds like it's more in the posture and not doing additional huge changes to change what we did last year.
Right.
So I see Delegate Bagnall's hand up. So maybe you can kind of explain the differences of what we're doing from last year's bill to this one, and why this one, the way that it is not needed. And with the amendment, it's still useful. So there you go.
Do you want me to take
That's a
that
lot.
one, Delegate Bagnall?
Sure, go ahead.
Okay,
Thank you so much.
So right now, the only thing we are changing from what we did before was
Okay.
that the hearing aid dispensers will now be appointed by the board. And the
Got it.
reason for that is that the professional association that was was designated to help in the nomination process has disbanded. And my understanding is there's currently two members or two vacancies on the board for hearing dispensers, and they can't get those members. So that was why I believe they were looking to change that particular aspect.
Okay. All right, thank you.
Ms. Stevenson, you are recognized.
Thank
Please,
you.
please go ahead.
Thank you. And also there were two reasonings for this bill to come forth. One, we're trying to get consistency again across all of our discipline, our largest discipline being speech language pathologists. It is the hope of the board to have all appointments handled the same, not have one discipline appointed by association versus another discipline appointed by board, et cetera. So the reasoning behind the bill was simply for consistency amongst all four of our disciplines. Secondly, they are trying to revive the structure from 2021. I believe our original structure did not include the organizations, and last year the bill came through that put the organizations back in. So our original structure was what we're requesting now, as opposed to what went through last year. If that makes sense.
Okay. So anyone else who wishes to speak to the bill as amended? Delegate Bagnell.
Thank you, Mr. Chair. And I didn't want to get ahead of our vice chair because she did an extraordinary job of explaining the conversations that we had. But during the bill hearing, we did hear the issue of being able to make this appointment. But we also recognized that this has been an ongoing debate where we have gone back and forth through legislation on the makeup of this board, on the quorum issues. And so I think that very respectfully, it's important that we address the emergent issue, which is not being able to make that appointment, but also maintain the language, the negotiated language from last year on the quorum, because we want to make sure that that the people who are being what the decisions that are being made are not being made without the expertise necessary to make those decisions. And one of the other things that we looked at is that there is not a lot of continuity across our boards. So we don't have to necessarily have continuity because we don't have consistency across our health occupations board, our health occupations boards. So I think this is a very reasoned and reasonable compromise to address the emergent issue, and then we can continue discussions as to what ultimately this process should look like.
Okay. No further discussion. All those in favor of the bill as amended, please say aye.
Aye.
Aye. Is anyone opposed? And this will be recorded as a unanimous vote in favor of the bill as amended. Thank you. House Bill 514, Health Occupation State Board of Chiropractic Examiners.
This bill makes numerous changes.
Lindsay.
Sorry.
Lindsay, go ahead. Sorry.
This bill makes numerous changes to the State Board of Chiropractic Examiners and the law governing chiropractic licensure, including altering board member appointment methods, expanding disciplinary grounds, and granting the board authority to conduct certain examinations of licensees and inspections, revising licensure qualifications, including changes to educational requirements and board administered examinations, and replacing the extern license with a preceptorship and authorizing the board to issue temporary licenses. I circulated amendments from the sponsor, which are identical to amendments that were adopted on the Senate cross-file, which just passed the Senate unanimously this morning, which increased from 15 to 20 the number of chiropractors required to nominate an individual to the board, and makes technical and clarifying changes relating to allowable inspections of chiropractors' offices, entities that accredit programs offering instruction in chiropractic, and equivalent national chiropractic testing entities.
So these amendments would conform the bill to the bill that has passed the Senate,
Yes.
the cross-file.
Move
Is
the
there any
amendment.
discussion on the amendments? Well, they need to be offered first, I guess.
Move the amendment.
So moved,
Second.
seconded. Is there discussion on the amendments? Okay, the bill, all those in favor of the amendments? Say aye.
Aye.
Anyone opposed? It is unanimous. Is there a motion on the bill as amended?
Move the bill as amended.
Second.
Delegate Bagnall moves the bill as amended and seconded. Any discussion on the bill as amended? Hearing none, all those in favor of the bill as amended, say aye.
Aye.
Is there anyone opposed? Seeing no one opposed, the bill is passed unanimously as amended. House Bill 938, Continuing Care Providers Governing Bodies Membership.
This bill requires the governing body of a continuing care provider that has only one subscriber member to authorize the appointment of an alternate subscriber to serve as a regular member of the governing body if the regular subscriber is unable to fulfill the subscriber's duties. The alternate subscriber may attend all meetings of the governing body and vote only if the regular subscriber is unable to fulfill the subscriber's duties as a regular member of the governing body. There are no amendments.
And was there any opposition to the bill?
No.
Okay. Allison? Leading aid.
Thank you, Delegate. Yes, there was one amendment that was discussed at the hearing and that we understand is a friendly amendment to the bill sponsor, and that was simply to change the effective date to January 1, 2026, to allow time for organizations to amend their bylaws and identify this alternate member. So we would just request that that be considered.
I
Is that,
I
has
would
that
move
been
that
before
amendment. I would move that amendment, Mr. Chair.
okay. So
Second.
moved by Delegate Cullison and seconded. All those in favor of the amendment, say aye.
Aye.
Anyone opposed? It is unanimous. Barbara Picato.
The only reason I have my hand up is to say that the residents support that amendment. Thank you,
Thank you.
Mr. Chair. Thank you.
Thank you. Are there any other amendments to the bill? Is there a motion on the bill as amended?
Move.
So
Second.
moved and seconded. All those in favor of the bill as amended, say aye.
Aye.
Anyone opposed? Delegate Warman, do you wish to speak to the bill or are you opposed to the bill?
No, I was just voting in favor. Sorry about that.
Okay, fine. Thank you. Thank you. Okay, we'll now go to discuss the two dentist bills, House Bill 45 and House Bill 534.
Ding,
Council,
ding, ding. Round one.
Council, do you wish to explain the two bills?
Sure. So House Bill 45 would enter Maryland into the Dentist and Dental Hygienist Compact. This is the one that, as of this month, 10 states have enacted this legislation. And House Bill 534 would enter Maryland into the Interstate Dental and Dental Hygiene Licensure Compact. As of this month, 6 states have introduced this legislation, but none have adopted that compact yet. I also circulated a chart that showed the various organizations and individuals who expressed support or opposition or no opinion on each of the bills. Hopefully, if you have it, it was color-coded in an attempt to make it easier for people to look at. So try and look at that in color.
Okay, is there discussion on these two bills? Delegate Hutchinson.
Thank you, Mr. Chair. I need somebody to give me a definitive answer on something that was brought to my attention as to whether with Compact 40, House Bill 45, since they don't receive a license, is my understanding, whether they can still bill under Medicare, Medicaid without a license. And I have not gotten a definitive answer back on that.
Mr. Wise?
Mhm.
Thank you, Mr. Chairman, and thank you, members of the subcommittee. I remember that question from the hearing, Delegate Hutchinson, so I went in and I pulled the provider manual for the Maryland Healthy Smiles Dental Program. And on page 25, there is a bullet point under the subheading Compliance, which says, all clinicians treating MHSDP participants should be credentialed and have an active license in the state the services are being rendered.
Is this a document from the state agency?
This is from the state of Maryland Department of Health.
Okay,
Looks like that.
okay. Delegate Hutchinson, you look like you have a
Just
question.
a point of clarification, Steve, I thought, did you say it says should or must?
Well, shall means must, but
Yeah, it says should be credentialed and have an active license in the state the services are being rendered.
Thank you.
Delegate Bagnell.
Mr. Chair, I was just going to point out that you have Matt Schaefer here from CSG, who has worked on a number of these compacts. So he might be able to give
And
us.
he has his hand raised, so Mr. Schaefer.
Yeah, thank you, Mr. Chair, and thank you, Delegate Hutchinson, for the question. We do have guidance from CMS that states that they treat authorization issued under a compact as equivalent to a state license. And I can send you that CMS guidance after this meeting.
Thank you.
Is there any other discussion? Okay. Delegate Riley. You're muted.
You'd think I would know that by now. Thank you,
No
Mr.
harm, no
Chair.
foul.
Appreciate it. So I was looking at the list that council just gave us on House Bill 45 and House Bill 534. And the favorable and unfavorable aren't matching the original witness lists. So that's one question. And is that the reason, did we make amendments to one or, to a couple of the bills that would change some folks' position on the bill? So if that could, be explained to me, I'd appreciate it.
There's no amendments. Can you be more specific about what doesn't match? Because I did ask both of the bill sponsors to double check that. So I thought it was accurate, but if it's not, I apologize.
Oh, okay, because I'm looking at 45 first, because it comes before 534. And it was like we had 14 in favor, 17 opposed, and on your chart, I have 12 and 7.
Well, the numbers won't necessarily be the same because I
Okay.
listed the organization and then all of the people who signed
people,
up for that
okay.
organization. Because if you had 6 people from the same
Gotcha.
organization, I just listed it as.
So that's what you did. You just
Yeah.
incorporated them. Okay, thank you. That
The
explains.
numbers might not be the same.
Exactly. All right, thank you.
Actual organizations listed are hopefully accurate.
Thank you.
And is there any progress that you're aware of or any action at the 6 legislatures, the 6 other legislatures, I believe the number is, where this legislation has been introduced? Mr. Cohan, perhaps you can speak to that.
I would like to speak to
Sure,
my thoughts on these two bills, not necessarily to that
that's
specific
fine.
topic. I have a prepared short statement that I'd like to read. My name is Dr. Barry Cohen, and I've been practicing dentistry in the state of Maryland for almost 51 years. I've been on the faculty of the University of Maryland School of Dentistry since 2011 as a volunteer assistant professor teaching dental students, dental hygiene students, and residents appropriate dental care, treatment of facial pain, and ethics. I have served as an examiner on the dental licensing examination boards since 2014, and I've also served on the peer review committee for Baltimore County for many years and was appointed by 2 governors to the Maryland State Board of Dental Examiners. The main purpose of my activity is to promote quality dental care. I've taken an oath to protect the citizens of Maryland to ensure quality care. Our state legislature and government has set up laws to regulate those practicing dentistry in the state and to protect the citizens of Maryland.
Print and color.
Dental
different print and
practices
color.
regulate those laws by regulating them by license. Practitioners with a privilege, not a license, will not be regulated by our profession or our laws. I have witnessed over my career numerous deviations from the proper care, abuse, and fraud. I've been utilized as an expert in legal matters in both the plaintiff and defense. I feel that I'm qualified to make the following statements. House Bill 0534, sponsored by the AADB, will require Maryland to issue a dental license. HB 0045, sponsored by the ADA, will accept licenses from other jurisdictions that will not meet the standards set by our governing body in Maryland and issue a privilege, not a license, to practice dentistry within our state. The checks and balances set up by the House of Delegates, the Senate, and the State Board will not be allowed to be regulated should HB 0045 be approved. States that have lower requirements will be allowed to treat patients to our citizens if HB 0045 is approved. It will not protect the citizens of Maryland. Even with all our current safeguards, I personally witnessed poor quality of care, decreased dental skills, lack of moral standards, and fraud. The citizens of Maryland have had the assurance of the dental profession regulating our profession for over 100 years. They deserve the continuance of that protection. Portability allows new dentists to be easily enter our state with a proper education and skill level. I have served as chairman of the Applications Committee of the Maryland State Board of Dental Examiners. I'm amazed to see the lack of skills demonstrated by some of those dental practitioners that have been practicing in other states or wish to be licensed. Those practitioners need additional training and mentoring before they are allowed to treat the citizens of Maryland. HB 0534 will ensure the quality of dentistry in our state as it has clear standards consistent with our state laws. HB 0045 will not allow that assurance. I generated a letter February 13, 2025, outlining other issues and comparisons of the 2 compacts. I'm not convinced that Maryland even needs a compact. However, if we accept the compact, the AADB compact HB 0534 will better serve the citizens of Maryland. This committee should understand the importance of the Maryland State Dental Association supporting HB 0534 and not supporting the American Dental Association Bill HB 0045. That's a big deal. I thank you for your time and understanding. Thank you for your time.
Thank you, Doctor. Delegate Bagnall.
Mr. Chair, I'm just confused about this subcommittee. We are discussing these compacts, correct? This isn't, we're not testifying on the compacts.
We're discussing it as a subcommittee. Yes.
Thank you very much.
Dr. G.
Thank you, Mr. Chair. I'm Archie representing AADB. I wanted to give the information that indeed we have actually 8 states that are presenting the bill, the Interstate Dental and Dental Hygiene Licensure Compact, and we have 8 states that we're in that process. and pursuing as well, just for your information. Thank you.
Okay. And no action taken as yet in any of those states.
The bills are formed, and they're going through committees and passing
This is
through
this bill.
Senate as well.
Yes. Delegate Cullison.
Thank you, Mr. Chair. I was wondering if I could ask Mr. Schaefer a question or two. If you have this information. And I apologize that I don't already know this. I think it's 10 states that have adopted the compact that is in House Bill 45. And so what has been the experience in those states relative to the number of complaints, disciplinary actions between and among the states, if we've had enough time in operation to even have a feel for that?
Yeah, thank you for the question. And so we're still in the early stages of implementing the compact that's in House Bill 45. So privileges are not currently being issued. There's about a 12 to 18-month process once we get the requisite number of states in order to get the commission stood up. And so in terms of your question around investigations and discipline, we don't have any information on that right now because privileges aren't being issued. I would say there is some precedent to look to with other compacts that Maryland currently participates in. There's some research that I was just sent yesterday on the nurse licensure compact that states essentially a nurse using the nurse licensure compact is 78% less likely to commit a disciplinary action than someone holding a regular single state license. So I'd be happy to send you that research as well.
That would be helpful. Thank you. And what's the prerequisite number of states?
7 states. So that was the state that was the number that we needed to hit in order to move forward officially with the compact.
And so you've just begun the process of moving forward.
We hit our 7th state last April with Maine. And so we've been over the course of the past 8 months or so convening the Compact Commission, which is again that governing body made up of representatives of each of the member states to start the implementation process.
Thank you. Thank you, Mr. Speaker. I mean, Mr. Chair.
Thank you very much. Delegate Bagnall, followed by Mr. Norris.
Thank you, Mr. Chair. And I almost did the same thing. Matt, if you could also speak to the earlier question about Medicaid, have we experienced any challenges in our other compacts with Medicaid reimbursement under the privilege, to your knowledge?
I'm not aware of any. The physical therapy compact and psychology compact have both been operating for a number of years now. I think they're both almost a decade old, and both of those professions bill insurance, and they utilize the same model, the privilege model that's in House Bill 45, but I'm not aware of any issues.
Thank you very much.
Delegate Cullison. I'm sorry, Connor Norris, and then Delegate Bhandari. My mistake.
Thank you, Mr. Chair. My name is Connor Norris. I'm the Director of Labor Policy at the Knee Regulatory Research Center at West Virginia University. I just wanted to quickly respond or add a little bit more information to Mr. Schaefer's comment. Myself and a few of my colleagues have done some research on the effects of similar licensing compacts for physicians and for the Nurse Licensure Compact. And we do find evidence that they are also effective in increasing migration of those professionals into the state. So it's an effective way to help increase the supply of those providers.
Thank you, Delegate Bhandari.
Thank you, Mr. Chair. This question is to Dr. Cohen, if you could answer. This House Bill 45 requires dentists and dental hygienists to meet national licensure standards. They have to pass the background checks and comply with each state's scope of practice regulations. Given these safeguards, what specific safety concern do you believe remain unaddressed that we could put in the amendment and pass this? Could you elaborate on that, Dr. Cohen?
The doctor available?
Yes, I'm sorry. Can you please answer that question again?
Oh, my question is, House Bill, I mean, listening to your testimony or discussion, whatever we call, you have a concern about the House Bill 45. You talk about the safeguard, it is not safe for our state, the population. And this bill, as I'm reading, it requires dentists and dental hygienists to meet national licensure standards, right? And pass background checks and comply with each state's scope of practice regulations. And given these safeguards, what specific safety concerns do you believe remain unaddressed that we could bring as an amendment and pass this bill?
Each state has different requirements. And it's requirements of taking a board exam or not taking a board exam, clinical board examination, taking certain types of continuing education. Maryland has very specific rules as to what they require a dentist or dental hygienist to be able to have in their background in order to be able to be licensed, and also to continue having a license. There are some states that do not require you to take a board examination. There are some states that allow you to practice having 1 year of a residency program after dental school. There are some states that will allow you to have a license just by graduating from a dental school. I believe in witnessing, I grade a lot of board exams on an annual basis. And looking at some of the things that I see, these people need to have additional training or skills improved before they should be allowed to treat patients. My job when I was on the State Board of Dental Examiners was to protect the citizens of Maryland. And I am very committed to that. And I believe that the requirements in Maryland should be kept to a certain standard. And I think that by allowing the compact will allow some people that have not proven that they have the clinical competency to perform proper procedures. That's one thing that the best that I can address your situation. Dr. G may be able to address other issues that are more detailed, but I can comment a little bit more on the medical assistance. I am a examiner for SkyGen. SkyGen is the people that administer and help administer the medical assistance program for dentistry in Maryland and the Healthy Smiles program. I am utilized to evaluate fraud in that system. I can tell you that I have never seen anybody in Maryland to apply for reimbursement who has not had a Maryland license. And I can tell you that in order to be an evaluator, I have to be a Maryland licensed dentist. So it might be that the compacts haven't come into effect yet, and that issue has not been able to be presented because it's just too new. But I think currently, in order to practice and to be reimbursed in the Maryland Medical Assistance Program, you must be licensed in the state of Maryland. So those are my two comments. And with all due respect, Dr. G is somebody who was also on the Maryland State Board of Dental Examiners, is much more adept to understanding the differences, the requirements of the different states. And I would defer to him if that's the wish of the committee. Thank you.
Next, person who's raised his hand is Delegate Hutchinson. followed by Delegates Hill and Bhandari.
Thank you, Mr. Chair.
Delegate Hutchinson.
I don't recall this from the hearing. There's a lot of information. Could somebody remind me the differences in the fees between each license or each compact?
Council, can you speak to that? Or
I can't speak to it. The compacts provide for the opportunity to charge a fee, but it doesn't specify what it is. It's set by rule. So perhaps the compact organizations can speak to that.
If I may, I can jump in here and speak to House Bill 45. So council is correct that each remote state gets to set a fee for the compact privilege in order to practice in that remote state. So Maryland would retain jurisdiction over the fee for the Maryland compact privilege. There is language for the commission to charge a fee for that privilege as well. Just as an example, the PT compact set that privilege fee at $45. So the applicant would be paying the state of Maryland their fee, and then the commission $45 to help fund the operation. There is also language in the bill that would allow for the commission to charge a state fee to participate, which I think is one of the differentiators that's been pointed out. I'll say utilizing that language is rare. Out of the 18 compacts that exist, only 2 of them actually use that language. And that's the nursing compact charges $6,000 annually to be a member of the nurse licensure compact. And psychology is $10 per privilege issued with a $6,000 cap. So pretty modest fees to participate in those 2 compacts, but none of the other licensure compacts utilize that language. They pass along the administrative costs to the licensee, the user.
okay. Delegate Hill.
Thank you, Mr. Chair. I just wanted to reiterate a couple of points that I hope will help address Delegate Bhandari's earlier question. First, in my experience, and again, I introduced the legislation that passed creating the physician interstate compact. That was the first healthcare compact we did in the state. Compacts in the medical profession work best when states have substantially the same standards, criteria, and methods of determining appropriateness of licensure. And that's pretty much true in the US for physicians. One of the issues that I think is central to this discussion and a key reason why the dental boards went about creating a separate compact rather than go forward with the CSG compact is because when it comes to dexterity, hand skills, it was felt significant.
My ghost is back.
Difference between different jurisdiction states and territories in how hand skills are assessed and evaluated, that many states do not feel that the criteria and the standards are substantively the same. Okay, so under 534, Maryland would retain its ability to apply the standards for hand skills that it thinks are critical, but it would not be able to do that under 45. If at some point Maryland decided that there are other ways of assessing hand skills that are as good or better, it would always have the ability to accept those ways simply by changing what the board accepts as evaluative of, meeting the necessary standards. It can't do that It loses that ability under the other bill. You asked what amendments could be offered to 45. Part of the thing with compacts is that once they have met their base number of membership to go into effect, you can't unilaterally change the compact. So there are no amendments that can be offered. You have to take that bill as it is. You can change it by going through the governing group and getting multiple states, but as a state, we can't change that compact. And there are two other advantages to 534 that I think are present. Number one, it only requires 4 additional states, and there are 8 states now considering it, okay, to go into effect. So we aren't really behind. It has been said that we're too far behind, and this is a great need. It allows, so that's one. And I'm just gonna leave it there. Oh, and because it hasn't met its minimum criteria, there's still opportunity. If we found there was something that we just couldn't tolerate about it, we have the opportunity to change it in a much easier fashion. Thank you.
Mr. Wise, Dr. G, Delegate Bandari, Dr. Ali.
Thank you, Mr. Chairman. I just wanted to provide some additional responses to a couple of the questions that were asked. Delegate Hutchinson asked about license fees. And my understanding of the principal difference between the AAD compact and keep in mind that's my client as opposed to the CSG compact. The AADB compact is very much a user fee. If you want to get licensed in another state, you're paying a fee. Whereas with the CSG compact, their commission has the ability to basically assess the states that belong to that compact. And they've done so in some of the states that have entered it. Whether that state chooses to use general funds to pay those costs or spread it out among licensees, I think is up to them. But the big difference is in our compact, only those that
let Mr. Wise speak.
Yeah, only those that are using it pay under the AAD compact. The other thing I wanted to mention was there was discussion about privilege versus license and what does that really mean. And I think the thing the committee should keep in mind is if Maryland has or in the future adds requirements for dentists in Maryland, under the CSG compact, those don't necessarily apply to licensees from other states. And let me just give you a couple of examples. If, for example, Maryland were to mandate malpractice insurance for dentists, the only area that the CSG compact says that the state law carries the day is as to scope of practice. So this malpractice example I'm giving is outside of that. So you are then at the whim of that compact commission on that issue. You've lost your direct authority over that. If this state were to require, if Maryland were to require additional educational requirements, training courses, for example, of all of its licensees, I think there's a real question about whether those privileged folks from other states would also have to comply with that. So I thank you, Mr. Chairman. I just wanted to add on to those questions. Thank you.
Thank you. Dr. G.
Thank you, Mr. Chair. I also wanted to do some clarifications, if you will, please. Number one is that Mr. Wise is absolutely correct. Ours is a user fee. We faithfully follow the Medical Interstate Compact. And so there is a fee to participate as a compact, and then subsequently, there would be no other fee except for the user. There's no levy to the state, and there's no charge any other charges. The way that it works is that because AADB already has a clearinghouse, they already have the infrastructure, they already have repository, that our compact would be able to be up and running in less than a year because we don't have to do the infrastructures that the CSG is going through that process now and delaying their time. So I just wanted to make sure that you understand that it's a user fee only and there's no levy at all in any possibility to the state or to other licensees. I also want to clear up, if you will, sir, that we're really talking about dentists, and dentists are, in our opinion, equal to physicians. Why? Is because we have independent practice. We can write prescriptions. We do anything that a physician does within the scope of dentistry. This is not the same as physical therapy. It's not the same as nursing. They are not independent practices. Dentistry is like physicians. And therefore, the language of the usage of license is critical. So even in all the other compacts in healthcare, especially in medicine, they talk about license. In this particular compact, the concern that all of us have at the dental board level and nationally is the fact that there is no mention of license. It speaks about privilege. And that puts us in the same category as physical therapists. Physical therapists, you cannot practice unless you have a prescription from a physician or a dentist. So the issue of license is critical, and that the concept of privilege is not the same for a physician or for a dentist. So I want to make sure we understand why that language is so critical. And a privilege in this case for the CSG compact only says privilege. It does not like even the nursing compact, which says licensing privilege. So at least a word of license is used there. And so, considering the fact that CSG is the expert, if they wanted the privilege to equal a license, why didn't they say so? And that would obviate all the issues we have as far as this compact that the AADB is then producing. So I wanted to make sure we had that cleared as far as the understanding of how that works. Thank you, Mr. Chair.
Delegate Bandari and then Delegate Bagnall.
Thank you, Mr. Chair. In the interest of the time, I will ask very straightforward question to dental board. Can you provide specific data or examples where similar interstate compact in other professions like nursing or medicine have led to safety risks for patients? That's what the concern is. If not, what makes dentistry uniquely different from these already successful compacts? Maryland is already facing a shortage of dental professionals, especially in the rural and underserved area. If we reject this compact, how do you propose we attract more qualified providers to serve this community without increasing bureaucratic barriers? And the last question to the dental board is, this bill makes it easier for military spouses who frequently relocate to continue practicing without unnecessary delays. Are we saying that we should make it harder for military families to access employment opportunities? What are your comments?
Delegate Bandari. I'm sorry, Delegate Bagnall.
I took my hand down. Sorry, Mr. Chair.
Oh, okay. I'm just going to go by Ms. Voight Holmes.
Thank you, Mr. Chair. So I just quickly wanted to piggyback off of what Delegate Hill said with regards to scope of practice. And I know that we have been using the term dentistry, but I wanted to say something specifically about dental hygiene in the scope of practice, where in some states, dental hygienists are allowed to be trained on the job, where they don't. I went through 2 years of prereqs, then 2 years of school to obtain a minimum of a certificate. And as a dental hygienist practicing 30 years, a former faculty and former program chair, I can certainly tell you that those educational standards need to be in place to offer safe, effective clinical care to the citizens of Maryland. And so where you have someone who now has the ability to come from a state where they were on the job trained, that definitely poses safety risk. Thank you.
Dr. Cohen. You are muted, Doctor.
Thank you. I just want to say quickly that as chairman of the applications committee, the state board, the portability of military spouses is very easy in the state. As a matter of fact, they get priority that if there's a military person coming into the state, the application for their spouse is placed on top of the list and processed properly and efficiently. There is no lack of time. They're given the priority of getting approved. Thank you.
Dr. Ali?
Thank you, Mr. Chair, for the opportunity to speak. I would like to address some of the questions that were posed. The first question was about remote areas. The AADB compact, which is House Bill 534, is a compact that allows more dentists from out of state to come in. So that is addressed with that compact. The second question was about the military, and the compact in HB 534 has provisions for that. It actually gives one additional year more than the CSG compact, the one in House Bill 45, where the military do not have to pay fees when they are no longer active. So it gives them one additional year without paying the fees to continue, if they would like to continue participating in a compact privilege or compact license situation. And currently our board does have, I believe the number was 31 military members who have utilized the current act that allows them to come in, and they do not pay the fee, and they have had no issue. The license has been administered to them within 5 to 10 days. So there really has not been an issue with the current manner that they are getting their license. There hasn't been an issue, and HB 534 will give even more, that additional year that is fee-free. And speaking of fees, the difference that we see between the two is that in 45, HB 45, it says that it's going to assess the fee to every single licensee. And in another state that is currently undergoing that, the fee has been assessed to every single licensee. And we feel that that's a little bit unfair, because in HB 534, the fee will be assessed to those who apply for the compact license. And that makes more sense to me, to charge the person who is applying, versus in HB 45, the fee would be assessed to every single licensee in Maryland. And I believe that that's unfair. So hopefully that some of the questions were already addressed with Mr. Wise and Dr. G, but I wanted to just provide our perspective as well. Thank you so much, Mr. Chair.
Thank you. Delegate Bagnall.
Thank you, Mr. Chair. And for the sake of time, I'm going to suggest that we hold both of these bills. I am concerned about hearing stakeholders speaking on a bill when they weren't at the table at its inception, with multiple opportunities to be at the table and raise these concerns. But I don't think that we have clarity, and I am looking at the time and recognize that we all have other obligations. So that would be my recommendation at this time. And I would put it to you, Mr. Chair.
I appreciate that. Let me just hear from Delegate Hill briefly.
Thank you, Mr. Chair. I just wanted to make a point that this is not meant to be disrespectful of CSG and all the work that they've done, or of Delegate Bagnall and all the work that she's done. And I think sometimes in the conversations, it feels personal, and it's really not. It is clear that CSG has a lot of experience with privilege compacts and licensure compacts. I think what has been missing in Bill 45 and how that compact was written is that, from what, maybe I misunderstood Mr. Schaefer, but my understanding is that CSG based the drafting of that compact on its experience in all these other medical professions. And what is missed is that dentistry is fundamentally different. It is not nursing. It is not social work. it is not medicine as we think of the field of medicine. It is a combination of surgery and medicine in a well-defined anatomic area with very unique and particular restraints. And you can't model it on things that it doesn't resemble and expect to have a product that addresses the uniqueness of the profession. So again, it's not personal. It's just that it would have been better to not model it on all the other ones and just to go back and say, what is unique and different about this? And why can't this just be done like all the other ones? And that's what the 534 compact does. Thank you.
Okay, we are going to conclude the discussion. Obviously, it will be resumed in the future. I wish to thank all those who participated, all those who listened, and I would move to adjourn this meeting of the subcommittee.
Mr. Chair,
Yes,
if I may, I just wanted to make sure before we adjourned that we bear in mind that this was CSG in collaboration, not just with the Department of Defense, but with the American Dental Association. I think it's important that we remember that as we have these conversations, that that we did have medical expertise at the table at the inception of this. With that, I will have no more comment, but I just wanted to make sure that we were also bearing that in mind as well.
very much appreciated. We are adjourned. Thank you.